So now, I want to introduce you to someone that I consider Kansas's biggest cheerleader. In fact, when he was a young Kansan, I just won't mention how young he was and how long ago that was, he forced people, actually his kids in the neighborhood, to join together in the yard around a cardboard table so he could tell them about Kansas, all the great things that are happening. And that's our president and CEO, Steve Coen.
Thanks, Chris. I never know how he's going to introduce me each year at this thing. He always comes up with something. Anyway, it's a pleasure to have you all here. I feel like I'm talking in front of 180 of my best friends looking around the room. It's great to have all of you here. Really appreciate you making time to be here. The famous playwright George Bernard Shaw once said, "Progress is impossible without change, and those who cannot change their minds cannot change anything." There may be some of you in this room who think in their minds that Kansas is still the same place as it was when they grew up. But the truth is, it's not the same as it was a generation ago or even 10 years ago. Change has happened very quickly in our state. We must change or we're going to be left behind. On the positive side of the equation, a recent report commissioned by the foundation using census data has showed that Kansas has the 13th highest rate of graduation in the country, a rate of 85.3%. 9 in 10 Kansans have confidence in our public schools, which I think is really encouraging with all that's going on in our state. We have the 4th highest rate of volunteering. We have the 9th highest rate of charitable giving, and we are becoming a far more diverse state with rising rates of African American populations and Latina populations, which is really a great thing as far as good new ideas and vitality. Now, on the negative side of the equation, as we all know, our population growth has stalled in recent years. We're well behind the population growth of neighboring states and the nationwide average. In the past 5 years, approximately 2% more people have moved out of our state than have moved into it. Along with this population, we all know our population is aging, and this is really going to challenge the use of healthcare resources in our state. And additionally, our job growth rate is slowing dramatically. And also, due to our current political atmosphere, which we all know about, we are becoming increasingly challenged to provide even the most basic of governmental services for our underserved. In light of all this, today I'm going to cover 3 things. First, I'm going to talk about the state of health in Kansas. Second, I'm going to talk about how the Kansas Health Foundation is changing its focus in light of all this. And third, I'm going to talk about what all of us need to do to reshape our reality in light of the current challenges facing our state. Now, those of you who attended our health symposium 2 years ago probably remember me talking about the America's Health Ranking Report. This is an annual report put out by the United Health Foundation that compares every state in many factors addressing health, such things as rates of immunization, cancer rates, smoking, heart disease, graduation rates, really about anything that affects health status. And the terribly distressing thing about this annual report is that Kansas has fallen from the 8th healthiest state in the nation to the 26th healthiest state in the nation since 1991. Now, as we have looked closer at that data and compared ourselves to the other states, we quickly found out that one of the key reasons that Kansas has fallen down to be as bad as it has is because we are not addressing tobacco use as well as other states are addressing it. Many of the other states, for instance, have taken a major portion of the dollars that they received from the tobacco settlement that many states have received and put that in tobacco use control, whereas Kansas spends a measly $1 million a year for tobacco use control. The remaining dollars go into the general fund. Obviously, this has had a huge effect on our rates of heart disease and cancer in our state. As we have looked more closely at the data, we also see that Kansas has higher rates of obesity, diabetes, suicide, and infant mortality than many other states. And across all these dimensions of disease, our state has even higher rates of health problems amongst our underserved populations. And just to give you a sampling of how much worse these rates are among our underserved populations, adults living below the poverty line are twice as likely to use tobacco products. African American and Latino women are at a 20% greater risk for heart disease. Those without at least a high school diploma have a 48% higher risk of dying of cancer. And for much of the past 20 years, infant mortality has been twice as high for African American women as it has been for whites. Now, going back to Kansas's overall ranking, let's look and see how Kansas compares to our surrounding states. First, let's look at Oklahoma and Missouri. They do much worse than Kansas. Oklahoma comes in at 45th amongst all the states, and Missouri does 36th. Obviously, we don't want to do as bad as them. We're a little bit better than they are. But let's look at Colorado and Nebraska. Colorado comes in at 8th. Now, a lot of people dismiss Colorado. They think everybody's healthy there. They all moved there because they exercise in the mountains and everything. So let's throw out Colorado. But Nebraska, everybody thinks, well, we ought to be pretty comparable to Nebraska, certainly. Nebraska comes in at 10th amongst the other states. So let's take a closer look at Nebraska's totals and see where they line up. Well, first of all, just looking at their overall totals and all factors, Nebraska is pretty much better across the board. But here are some interesting statistics in Nebraska. Infant mortality, we're ranked at 29th. They come in at 7th, a huge difference. Heart disease deaths, we're ranked at 26th. They come in at 16th. Diabetes, which has a huge relationship to obesity, we're one of the lowest states in the country on obesity, higher obesity rates. We're 29th, they come in at 15th. And then public health funding, I think this is a real key. Here they are at 22nd in the country, which isn't really, really high. We're down here at 44th in the country for public health funding. We spend about $45 per person in Kansas in public health funding. Nebraska spends about $77 per person in public health funding. So I think that's a real key right there. And they're not even high in the country for public health funding. So I think that's a real key in the difference right here. So, if our health ranking has fallen from 8th healthiest to the 26th healthiest in 25 years, during what I would guess many people in this room think were the good years in Kansas, then what does the future hold for our state? Especially in light of continued cuts in state programs providing funding for those in need, our recent cuts in Medicaid, and the fact that our legislature seems to have absolutely no interest in expanding Medicaid, which would provide care for at least 150,000 people. And then also on top of this, we have all these recent cuts in funding for education. Obviously, all this doesn't add up to a very good future for our state unless something changes. And we have to ask, is our ranking going to continue to spiral even more, particularly for those in need? So, what is the Kansas Health Foundation going to do to help address some of these problems? I imagine many of you in this room know that we just celebrated our 30th anniversary. As part of that 30th anniversary, the board and staff spent the entire year looking at what has happened to the state of Kansas, collecting data and examining that information. We also listened to Kansans to see what they thought we should do, and discussing how we could best evolve our organization for the future. And as part of that process, we developed our first ever vision for the foundation. And this vision is up on your screen. It's to ensure that every Kansan has the opportunity to make healthy choices where they live, work, and play. And I want to point out the key word in that vision. The key word is every. Because we all know, I know you all know, that not every Kansan has that choice today. Underneath this vision, we have two program areas. One is called Health Equity, and the other is called Civic Health. And I first want to talk about the program area called Health Equity. And to define health equity, I'd like to share a story that I heard recently that I think defines what health equity is all about. Imagine you have three people trying to look over a fence. Equality would be giving every single person the same size box to stand on. The box may be sufficient for that tallest person to look over the fence, but it certainly wouldn't be sufficient for the shortest person to look over the fence. Equity, however, is giving each individual the right size box to look over that fence. One size doesn't fit everybody. It doesn't help everybody to look over that fence. A person who has been discriminated against for some reason. A person who doesn't have significant financial resources as opposed to one who does. A child who grew up with a physical or mental handicap as opposed to one who didn't. I know in my own case, my wife and I have a daughter whose picture is up here on the screen, who struggled in school. As you can imagine, this was very troubling to us, particularly since no matter how we tried, no one seemed to be able to help us find out what the heart of the problem was. Finally, after countless hours of testing and meeting with school counselors and specialists, Jennifer was diagnosed with a learning difference, and we were finally able to get her the help she deserved. Fortunately, because we were educated and we were persistent and had the resources to pay for it, I am pleased to say Jennifer went on to graduate from college with excellent grades, and she's very successful today. But I have to say, it wasn't easy. It took a lot of hard work, and I have to say I give most of the credit to my wife, Monica, who's here today, because she just wouldn't give up. But what about the kids whose parents don't have the resources? Kids whose parents aren't educated and don't have the resources to help their kids to be successful. Their kids are the ones who are left behind. Not just in school, but for the rest of their life. Those of you who are in the room, her parents, know that being a good parent is certainly not an easy job. Even under the best of circumstances. You have to nurture, you have to care for your child each and every day. You work hard as you can to make sure that they grow up to be caring and productive adults. Unfortunately, many kids are born into a life that just doesn't provide them with the tools they need to succeed. And you know what? That breaks my heart. And I'm sure it breaks the heart of most of the people in this room today. And in many cases, it's not the parents' fault. They're struggling just to pay the rent, put a meal on the table, and deal with a multitude of issues that they may be dealing with because of their lot in life. How do we help their kids? How do we provide those kids with a chance to succeed? Just like Monica and I did with Jennifer. You know, research clearly shows significant differences in health outcomes among populations based on education levels, race, ethnicity, where someone lives, and income levels. Some counties in Kansas are among the highest in the nation for infant mortality rates among African American mothers. In fact, according to the most recent data, the overall infant mortality rate in Kansas is 6.3 deaths per 1,000 live births. For the past 20 years, however, the rate for African Americans has been nearly double that rate, with particularly high rates in the counties highlighted on this map. We see huge achievement gaps for children from low-income households or for those with minority populations. We must address these issues for the future of our state. That's why health equity is so important. Everyone should have the opportunity to do what they need to be done for their own children or their own families. So, what is Kansas Health Foundation going to do about this? Obviously, these issues are complicated and they're difficult to tackle, or as the Kansas Leadership Center would say, these take adaptive, not technical solutions. One of our first attempts to try to begin to work in this area is at the community level is our community engagement initiative. I think some of you have probably heard about that. It was a request for proposal effort that we launched last spring where we gave 5 grants to 5 communities. These grants were resident-created, resident-led efforts to create more vibrant communities focused on health and wellness for all citizens. This effort is focused on disenfranchised communities experience high levels of poverty, low education levels, and poor health outcomes. Though I don't have time today to talk much about these efforts and what is happening, it's really encouraging to see what's taking place in these communities so far. Our second program area is the one we are calling Civic Health. By this, we mean engaging citizens who are willing and able to improve their communities. People willing to show the leadership needed to make change happen. People who care enough to make their voices heard. I need to point out that even though we have 2 program areas, health equity and civic health, these program areas, of course, are not mutually exclusively. As you can obviously see from our civic engagement initiative, we are engaging community citizens in those communities, in those underserved communities to improve their health. The truth is, you really can't have healthy people without healthy communities. You can't improve health disparities or provide more opportunities without civic health. Earlier, I referred to a civic health report commissioned by the foundation. A key finding from that report was that Kansans who are not civically and politically engaged in our state also experience the poorest health outcomes. As a result of that report, one of our most recent grant programs was to identify key census tracts in Kansas with high rates of uninsured, minority populations, food stamp utilization, poverty, and low voter turnout. We then invited groups to apply for funds to conduct nonpartisan voter registration and get out the vote efforts. It'll be interesting to see how that plays out in these next elections. Today, of course, I can only touch on a few of the programs that the foundation funds or will be funding in the future, but let me say we are committed to working with you and our partners in the state to address the issues related to health equity and civic health in the future. So, where do we go from here? Well, we know it's best to build on your positives. We have a strong education system in Kansas, and please, I hope we don't lose that. We have a culture of service, volunteering, and charitable giving. And we've always known in Kansas we have a strong work ethic and resiliency. But on the other hand, as you've heard me say today, we can't ignore the challenges facing our state. We have fallen from the 8th to the 26th healthiest state in the nation. Our state's population growth has declined significantly, and our population is aging. And we have a political atmosphere now that is cutting the most basic governmental services for those most in need. This is the reality of the state we have today. The questions now become, are we okay with this? Are we satisfied that large groups of people are being left out of the democratic process? Does it matter that the odds of good health are stacked against so many? I imagine most of you in this room would join me in saying, we want a better future for Kansans. We want every Kansan to have the opportunity to make healthy choices where they live, work, and play. So how can we change this? How can we reshape this reality? Well, you know what? It all starts with being engaged. Speaking up for what we know is right. Becoming the answers to these problems. We must be the voice for those not engaged and encourage them to become engaged. I sincerely believe we are at a tipping point in our state where if we continue to let a small handful make the decisions for the masses, it could be many years before we recover. But if there becomes a groundswell of grassroots advocacy, a majority of voices standing side by side with our community leaders and elected officials, democracy will result in many years of prosperity for Kansas. We need loud and informed voices from the public that want things to be different in Kansas, that we want Kansas to be a healthier state for every Kansan. I know this all can seem very daunting at times. We've seen many changes in the recent decades taking us further away from where we want to be as a state. But I do believe together we can reshape Kansas and make this a reality. And you know what? If we need the inspiration to guide us in this process, if we need a reminder of what can happen when a group of citizens speak out for what they believe in, there's a story that I would like to share today. A story that I believe many of you in this room probably don't know, even though it occurred right here on this very corner of this very block where the Ambassador Hotel now sits at Douglas and Broadway. It occurred almost 60 years ago. The year is 1958, a difficult time for race relations in our country and a time of segregation in many places, including right here in Wichita, Kansas. At that time, a group of young people with courage most of us can only dream of having told the National NAACP office that they wanted to stage a lunch counter sit-in at the Dockham Rexall drugstore in downtown Wichita. They were told it was too dangerous, they were told it wouldn't work, and they were told it wasn't time. And you know what? They ignored the advice of the NAACP and others, and they organized together to make their idea a reality. In the face of threats, in the face of name-calling and hate, they stayed strong. Led by Ron Walters and Carol Parks Hahn, this group was quietly and historically making history. The result was a striking blow to segregation and racism in our city and state. Within 2 weeks, the lunch counters at all Rexall drugstores in Kansas had changed their policies, and the people of all races and ethnicities were being served. In the process, it became the first successful youth-led lunch counter sit-in in the United States. Yes, that's true. The first. It didn't happen in Greensboro. It didn't happen in any other southern city. It happened right here in Wichita, Kansas, in July 1958, right on this very block. This is what happens when a small, committed group believes they can make the difference. Unfortunately, over time in history, this has faded into the background. Other milestones in civil rights movements in places like Selma, Birmingham, and Greensboro are often more referenced and utilized as teaching moments in history. But we can never forget what happened right here in Wichita, Kansas, beginning in July 1958. So at this time, I'd like to invite Mark McCormick to come up here. He's executive director of the Kansas African American Museum, to join me in front for some special introductions and announcements. Mark?
Thank you, Steve. We do have the pleasure of having a couple of the people who participated in that sit-in here with us today. This is Joan Williams. Dr. Galen Vesey. I also have some of my board members here today. Dr. Robert Weems is our board president. I have Ted Ayers, the vice president, general counsel emeritus at Wichita State University. You see him in the hall later. He likes to be called Superfly.
Okay.
And we also have Dr. Gretchen Ike. To give you a little context, I think we know about this sit-in and its historical context because of Dr. Ike's work. She wrote the book about the civil rights movement, not just here in Wichita, but in the Midwest. It's called Dissent in Wichita, and it's available wherever fine books are sold. Isn't that right? But one other thing that I'd like to add, and I hate that I skipped over her, but I have Kristen Brethette here, who is my education director at the museum. Kristen, could you stand, please? Could you? So as you may or may not know, in Washington, D.C., we're building a brand new Museum of African American History and Culture. When that museum opens, this photograph will be there, and it will commemorate what happened on this block. I think that deserves a hand. And in appreciation for you inviting us here today, we would like for you to have this
Oh, well,
picture.
thank you so much. Wow. That's wonderful, Mark.
Thank you.
Thank you.
Yes, sir.
Well, thank you to all of you. You are certainly an example of how civic engagement should be, and we want to make sure this day is never forgotten, or this event is never forgotten. So in that spirit, I'm pleased to announce that on behalf of the Kansas Health Foundation Board of Directors and staff, we are going to be providing a $50,000 grant to the Kansas African American Museum to partner with the Ambassador Hotel next door to commemorate this event. There is no recognition for this event taking place, so they're going to be creating a permanent exhibit next door at the Ambassador Hotel to commemorate this historic event taking place here in Wichita. You all are an example to us, and we are so proud of what you did at this very courageous time. Thank you so much for what you've done for Wichita and for the nation and for your people. With that, it's time to officially begin our symposium. Thank you all for being here, and hope you enjoy your 2 days with us.